trending now.
The NFL preseason ends tonight with all 32 teams playing. The deadline for roster cuts is Saturday afternoon. The Rams restructured the contracts of 2 players, according to ESPN, clearing space for a new deal with Aaron Donald. Linebacker Elvis Dumervil retired after a 12-year NFL career and over 100 sacks. He was originally drafted by Denver. David West retired from the NBA after 15 seasons. Maria Sharapova plays a second-round match tonight at the U.S. Open. Number 5 Petra Kvitova advanced today. The PGA playoff event starts tomorrow outside Boston. 2 day games in Major League Baseball. The Brewers go to the bottom of the 9th, tied 1-1 at Cincinnati. Twins are leading 2-1 at Cleveland in the bottom of the 6th inning. The Yankees and Jay Happ tonight host a Detroit team that's lost 5 games in a row. I'm Steve DeSager.
We are Fox Sports.
Hello, Cynthia here with Dr. Tieche, Coffee Talk with Dr. Tieche. How are you doing today?
Good. End of the month already. Summer's over.
So that means I can put my fall decorations
Not at all.
out.
Wait till it gets fall first.
Well, that'll never happen because we live in Florida.
I can hope.
Well, I think September makes it to where I can put them out. Because I almost put them out in August because I got a little excited.
It's crazy.
But I'm putting them out. I don't really care. I'm doing it. So we had a great open house Saturday, didn't we? Mm-hmm. Well, you wouldn't know because you were stuck in the room the whole time. So if you came out, thank you for coming. And if you didn't, shame on you. No, come to our next one. But if you came out and it was too busy for you to even get to talk, just call us, set up a consultation. We offer free consultations all the time. So, and if you did come, then you know how busy we were. We were extremely busy from the minute we opened to way after we were supposed to close. So very good, successful open house for us. It was pretty exciting. We love seeing, what's going on. And I think everyone was even though it was extremely busy, like packed, I think everyone understood and was very happy for us for being so successful. Really, we've just grown like crazy. So, yay. We are doing something in September too. The Botox at the Boutique. It's towards the end of the month. I'll give you more information on that later. So I want to talk about weight loss a little bit. I had a talk a few months ago with a bunch of ladies and I had my slideshow going and I was just talking about, okay, so seriously, it's not that hard. If you want to lose weight, just stop drinking soda, stop drinking all your Starbucks drinks, start counting your calories, getting them a little lower, stay in ketosis, work out. Come on. I mean, it's simple. And someone raised their hand and she's like, well, I tried everything and none of that worked for me. And I was like, okay. I said, so what did you do? She's like, I came here. And I'm like, okay, I promise I did not plant her in this audience. I did not know if she was even coming. I don't even know her. But she said, I tried everything and nothing would work. And so I came here and Dr. Tieche looked at my thyroid and said, well, here we go. This is the problem. And so adjusting that is what made the difference for her. And now she could continue doing all of those things, but actually see results. And that's so common. And we've talked about this before. If you watch our show a lot, you've heard us talk about this, but I want to just always remind you guys, if you are trying everything, like really, you're not lying, you're not closet eating, you're not eating, drinking wine and all that, you're really trying and nothing's happening, it can be fixed. And we see that all the time.
Just happened this week. Person that really is very concerned about their fitness and working out and diet reached a plateau and they were struggling, and we did lab work on them and their thyroid was significantly down and put them on some medication, and this past week they lost 4 pounds. So changed everything, just kind of readjusting the whole system there, getting them fine-tuned again. And so that's what it is. Another thing though that is definitely important with weight loss is persistence and staying with it. I mean, it's not always just a 1 month thing. Sometimes it takes longer than that. Yep. And it takes that, and it takes lots of accountability. And, coming to a weight loss clinic, Even if you start losing weight, doesn't mean you can stop that and you're like, okay, I got it now. I don't need to do this anymore. And that's not really how it works. It's sort of like I work out. I know how to work out. I know how to lift weights. I know how to do it. But I've had a trainer since the beginning of the year, and it helps every time I go. Because there's sometimes when I'm very motivated and probably wouldn't need someone, but I can tell you most of the time I'm not. And if I didn't have that person helping me every time through those workouts, helping me to kind of achieve my goals, I'd be way further behind. And that's really what a lot of it is. He doesn't teach me new exercises every time. He doesn't, there'd be a lot of different exercises that he'd have to come up with, and they're the same over and over again. So it's really the same things with weight loss. It's the same principles. Sometimes, people, it's the same thing over and over again. Well, kind of is. It kind of is because you haven't gotten it. And so, we do backslide, we do have some mistakes and things like that, but it's very important to regroup and have someone who's got your back and who is trying to be a coach and help you. And that's really what the accountability of most weight loss programs are. Because there is really nothing magical. We do have some tricks. We do have some ways to accelerate your weight loss, but it really is having someone there to help continuously keep you on path and keep you doing your best and achieving the goals that you want when you first come in. And so sometimes people get sidetracked and they forget, and then all of a sudden they're down another path. So it's important, and that's really, I think, a very important thing is consistency and accountability. Mm-hmm. That's what is very important in these programs, and it's in a lot of programs.
Mm-hmm. Yeah, definitely. So our weight loss program does include obviously a diet. Some people are like, "Is this a diet?" I'm like, "Yeah," but it used to be where we wanted to just say, and I love saying it's pretty simple math, guys. Calories in, calories out. That's how we're going to lose. But it doesn't always work that way. So that's the point. We want to make sure that if you are really doing that and it's not working, then there is more that you can do. And like he said, consistency and accountability, like that's a huge deal. We have people on our weight loss program for a year, and maybe they had more than 50 pounds to lose, or maybe they just really want to make sure that they maintain, it's not like he said, it's not like every week you're learning something brand new that you've never heard before. Sometimes it's just accountability and someone to keep you on track and say, okay, whoa, this was what we were doing here. Let's get back on track. Okay, you messed up. You had some birthday parties to go to. Now we're going to do this week to get back on track and change it up a little bit.
Because it's easy to let 1 pound become 5 pounds and 10 pounds. And that's how a lot of people have gotten into the position that they're in.
Yes.
Is that it's that little bit of sliding. And when it's right in your face and you have someone else that you have to look to and deal with about, then it becomes much more real. When it's, you at home, oh, well.
Yeah. We have, we have our weight loss program that we believe is the best because it's just so many different things. It's very comprehensive. But we're starting a 6-week shred program also. So this is not really for someone who's trying to lose 50 pounds. It's 6-week shred. It's those people who are maybe a little bit more active and just need something a little different than the long-term weight loss program that we have. So if you're interested in that, that'll be rolling out pretty soon to get ready for the holiday parties that we all need to wear our little black dresses to. Well, not you.
Why are they black?
It's just a thing that women say, little black dresses.
Okay.
It's LBD, little black dress.
Oh, okay.
Yeah.
So
all women know about it.
Do they?
Mm-hmm.
LBD? Okay, it's the code word. Okay.
Yeah.
Well, that's my fact for the day.
That's my fact for the day. Before you sidetrack us, so we have held coffee talks at our clinic many, many times. And I've done ladies' night talks, and basically we come and it's open and people sit and we talk just like this, but with other people. So we've been doing this on the show a lot, and we have a lot of people that will comment when they can. But we really would like to hold another one coming up soon at the clinic, possibly. We've done Saturday mornings and then we've done some evenings. It seems like the evenings are better, but if you want to be involved and come to one of our talks, we will probably do a Facebook Live video also, and you can be involved in the talk. So let us know by commenting or sending us a message that that's something you'd be interested in being a part of as our audience. So now what? Now you're allowed to speak. You may speak.
Thank you. Well, that would be fun. I mean, because a lot of people can talk almost like a open town hall type thing.
Right. It'll be a recharge hall.
Recharge hall. Except I won't be walking around with a microphone or anything.
No.
You might be, but I won't be.
Yeah. And then we can have my keto cookie night that same night.
Ooh, okay. I'm in for that. So I wanted to talk about a couple of interesting cases that we had this week that, that are always kind of why we do different labs, why do we go through stuff as opposed to, just treating people empirically, which means without doing stuff and evaluating stuff. So one is about a man who was getting ready. He was a middle-aged man, and he was going to come in. He had fatigue and all kinds of symptoms suggestive of low testosterone. And so we were going to start him on testosterone based on his history. But as we do, we usually get a screening set of laboratory things on them. And those include, clearly the testosterone and estrogen, but it includes a full panel of other things, primarily because most men, unfortunately, don't go to the doctors routinely, and so they don't get anything checked. So that's kind of my opportunity to give them the once over before and go over all their labs, check their cholesterol, check everything.
And they really like that. That's a really nice thing that you do for them.
And go over them, and then to make sure, listen, hey, this is something in addition to that, instead of just being a one-trick pony, just doing, oh, I'll do a finger stick testosterone, your testosterone's low, and then start treating you without doing anything else. And that's not really a great standard of care because, people could have other problems in addition to low testosterone. So, you have to check everything else. I know there's some places that don't do it that way, and they just check a testosterone, and if it's low, they treat you. So anyway, that being said, on our screening panel, this guy's PSA, which is the prostate surface antigen test. It's a screening test, pretty much, just a screening test for prostate activity. So it can mean many things. It can mean when that number is elevated, it can mean, that you have cancer. It could mean you have an infection or, stuff like that. But what it means is, hey, we've got to evaluate this. So this guy was elevated. He had never really had one before. And I think he said, maybe he had it in the past, but it was normal. So that made it totally different. So I ended up, before we started any therapy, we sent him to a urologist to be worked up and evaluated. And he actually had some biopsies, and he did have prostate cancer. And so it was picked up in its very early stages because he just had some very small tumor cells. And actually next week he's having his prostate removed. And so, although that it's horrible that he does have prostate cancer and he has
Thank God you found it.
He has to have it removed. It's good in two things. One, that we did that lab to see it and check it, and we do that all the time. But instead of just in the beginning, if I had just done a testosterone level on him only and treated him, I don't know where he would be right now, So and so that's why it's important. So that was an interesting case, and to just say, wow, okay, it does happen. And so far, we really actually have picked up 2 or 3 prostate cancers this way by doing it. Not that I really want to find any. I don't want to find any. But
but you're being responsible and doing the right thing.
I want to do what's best for our patients. So that was one of a man. Another one was of a female who has had.
Oh, we're gonna come back to that one. Music is on.
The GOAT FM. We're Gainesville, Ocala's All Talk.
Hi, this is Cynthia from Recharge Clinic. If you are struggling at all with your weight loss, you need to come in and see us. 47 Southwest 17th Street in Ocala, Florida. Check out our website, rechargeocalaclinic.com. That's rechargeocalaclinic.com. rechargeocalaclinic.com. We can help you. We will get you through whatever weight loss struggle you are facing.
Hi, this is Lauren Gibson from Lauren Gibson State Farm. Did you know that 70% of Florida drivers are underinsured or not insured at all? In Marion County alone, we had over 90 deaths from car accidents in 2017. At Lauren Gibson State Farm, our mission is to protect and provide for our customers. Please go to my website at insuredbylauren.com or call me today at 352-355-3340.
BJ Trophies, so much more than just trophies. Now offering in-house production of decals, signs, and banners. Let them put your logo or design on almost anything. BJ Trophies also has traditional wedding, baby, and anniversary gifts, plus custom 3D crystal pieces, jewelry, and engraving. BJ Trophies making one-of-a-kind awards for your one-of-a-kind events for over 30 years. Don't forget, BJ Trophies now offers banners and decals for your business. Stop by BJ Trophies on Northeast Jacksonville Road or call them at 732-2249. That's 732-2249 or online at bjtrophies.com.
Document Technologies has been helping Ocala business owners save money on their copiers and printers for more than 7 years. Now they've added the full line of award-winning color copiers and printers from CopyStar. CopyStar has a reputation for their overall low cost of ownership and unmatched reliability. Combine that with Document Technologies' fast local service and 5-year guarantee, you have a combination that can't be beat. Plus, they have special programs for nonprofit organizations and government programs. To find out more about how Document Technologies and CopyStar's award-winning color products can help your business, call Bill Schroeder at 352-368-6664 and start saving today. We use Document Technologies, and so should you. Call 352-368-6664.
And in Gainesville at 372-6666.
Document Technologies, the only copier company you'll ever need.
Have you ever looked at a homeless person and wondered what it's like to walk in their shoes? I'm Carla Grimsley with Interfaith Emergency Services, and we are hosting a 1-mile walk to benefit our homeless shelter and raise awareness for the homeless. This is a walk that will change you for good. To learn more, visit our Facebook page at Walk a Mile in My Shoes 2018 or the Interfaith website, iesmarion.org. Take a walk with me September 1st. The person you will impact the most is you.
You cannot ignore Facebook. Facebook live streaming.
The GOAT FM.
Hello, Cynthia Tieche here with Dr. Tieche. We were just talking about some interesting stories, which we have a lot of interesting stories. But we like talking about these stories because it helps people relate and say, oh yeah, I feel that way, or I know someone that feels that way, or whatever. So that's why we like to talk about these. It really does help people to understand what's going on. Mm-hmm. So go on about your other story.
My other
today.
story was...
I can't wait to hear it. I'm curious.
Was a woman who has had fatigue for many years, and has seen her primary, and was told, oh, your thyroid is a little bit low. We'll put you on some thyroid medication. Okay, that's kind of a common story, but the follow-up to that story is, when you go back, what do? Well, they don't do anything. They check a lab and they say everything's fine. But the main question that they don't ask is, do you feel any better? Has anything actually changed? So has been on this dose for quite a while, really not noticing much significant difference, continuing to have hair loss, difficulty losing weight, extreme fatigue, really dry skin, all the symptoms of that. And so as part of our workup, we did do some lab tests on them, and I'll just kind of go through some of the thyroid tests that we look at. We look at TSH, and that's what your brain is telling your thyroid to make, and that's kind of a loose indicator of thyroid function. People use that as their main goal, but as their main guide, which is in the perfect world is that way. So what happens is TSH tells your thyroid how much thyroid to make. It acts as a thermostat. And if it perceives that there's a lot of thyroid hormone, it backs off. If it sees that there's not a lot of thyroid hormone, it increases. So if someone says, wow, your TSH is high, they will empirically say your thyroid is low and treat it. Or if they see that it's normal or low, they'll say your thyroid is normal and won't treat it.
Because if it's high, then that means it must see a problem and it's overworking right now.
And so it's saying make more.
So that's how they treat it.
And so that's how they do it. So
sounds right.
It sounds that way in the perfect world. So in the perfect world, the next thing is what your thyroid makes, which is T4. And so you look at that. Now it's called T4 because there's 4 iodines on your thyroid hormone. And so those two should correlate exactly. They sometimes do, but sometimes they don't. You could have a normal TSH and a low T4. And so that's what happens. Or
so maybe your TSH isn't picking up. There's a problem. It's
correct.
Not
so
seeing.
If you use one test only, you're only going to kind of use it as a screening test and say, well, okay. And then the next step is what's called looking at T3, and that's the active thyroid hormone. And so what happens is T4 is what's made. It has 4 iodines. It circulates around your body. 1 iodine comes off. That's the main problem where most people have is that conversion. So that test is almost never looked at T3. So what happens is you'll see people who may have a totally normal T4, but a markedly low T3. So they have all the symptoms of low thyroid. They could have a normal TSH, normal T4, and very low T3, and they feel crappy. They have all the symptoms. So if you never look, you don't find.
Yeah.
So in this person, that's exactly what happened. She had kind of a borderline TSH, maybe a little bit high, a normal T4 at this point that I saw her because she was on Thyroid, which is a synthetic form of thyroid medicine of T4. So if you looked at her labs, you say, wow, you should feel great. But then you go down to her T3 and it's very low. So a normal range is 3.5 to 4.5. Hers was 2.5. So that's very low, particularly when someone has symptoms to correlate with it of all that. Now, that being said, that was one thing. So we know that she has a problem converting, so that she needs some additional medicine or a different medicine. But more importantly was the next test that was not done, and that's called the TPO, thyroid peroxidase antibody test. So what we look at with that screening test is we look to see if a person is making antibodies towards their thyroid. And on hers, that number was greater than 500. So that should be low. It should be basically 0. So that's an indication that your body is having some sort of inflammatory response and making antibodies that are blocking the hormone from working. So when that's really high, you have symptoms, even if you had normal levels of thyroid, of hypothyroidism, because it's blocking it. And so that was never addressed. They had never looked at that before. So that's also called Hashimoto's thyroiditis, if anyone has heard of that. Now, what's interesting about Hashimoto's is there's a very high correlation between that and gluten allergies.
Oh, yeah.
Yeah. And so when I asked this lady if she had a gluten allergy, she says, no, I don't. And I said, okay. I said, well, how about if you eat pizza? How do you feel? She goes, oh my God, I have a stomach ache for 3 days. I am bloated. I have that, blah, 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 blah. I said, well, how about when you eat bread? Oh, the same way. If I eat biscuits, my stomach hurts for a week. Well, so the fact is, she did have a gluten allergy or a gluten sensitivity. She just didn't know because no one had told her that, and she didn't really know this label. So when I asked her all of the questions about all the things that have gluten in it, she was positive on everything. And in fact, she had actually had started our Weight Loss program, which is a gluten-free diet, and felt better. And she goes, I just feel amazing. I don't know why I feel so much better. And I said, well, it's 2 reasons. And anyway, so it was an interesting thing that I educated her about this gluten sensitivity and how to avoid this once she comes off the diet, and then basically made some adjustments in her medications to help her feel better. So, sometimes you have to look at the whole picture, not just pick one thing and say yes or no, and just tell someone, yep, everything's fine. You have to listen, you have to hear what they're saying, and then correlate the two together. If I wish it was just so easy to be able to look at lab values and just say, yep, yes, no, and that. But it's not. It doesn't work that way. It rarely does. So anyway, I thought those were 2 interesting cases, and we see them quite often, thyroid a lot.
The thyroid thing is like every day we hear it. And
well, it's because really
it's just that. It is confusing. When you hear it, you're like, whoa. I mean, you lost me. TSH, T4, T3, TPO, what?
But there are some studies
but if you read about
indicated that's up as high as 50%. And so that's a lot. Every other person has, low thyroid.
I'm not even sure. Maybe we've had one or two patients, maybe. I'm just going to say that. But in my head, I can't remember any patients ever coming in and their doctor had looked at any of those numbers. All they do is look at the TSH and maybe the T4, which if you're still feeling like crap, clearly there's more. But I don't understand. I guess they just never went further with the thyroid education. I'm not really sure. So, and Synthroid, they put everyone on Synthroid levothyroxine. Which, if your T3 is low, is that what you'd put them on?
No.
So, there's more testing. It can be fixed. People can feel better. It sucks that they're just not getting the proper care. But they're not. And so, if someone's TPO is high, so that really is what tells you that they have that Hashimoto's, right? Mm-hmm. But what is the cause of that? Is it all the gluten that's causing that?
No. There's a high correlation between the two. So not everyone that has Hashimoto's has a gluten allergy, but many people who do, the worst. It's kind of an indication of an inflammatory response that's going on in their body. So in other words, something is triggering this inflammation in their body. Typically, it's a reaction to something that's going on. So something they're eating, something they're being exposed to. So it's something to say, listen, hey, whatever we're doing, your body's giving us a warning sign, and it's saying it's not reacting well. It's probably not feeling well as well. But most people disregard that not feeling well thing, and so
they just get used to not feeling good.
Yeah. So anyway, that's going to bring me back to a topic I want to talk about in a few minutes. But I wanted to go on something else that I thought that people have asked me about quite a bit.
Before we move on, one more thing. I just wanted you to list earlier, and since you brought it up, can you just list some of the common side effects or feelings of thyroid issues? Like, what are the symptoms?
The most common ones are fatigue, particularly afternoon fatigue. For females, hair loss. That's another one that's super common with thyroid. Dry skin, constipation, weight problems. That's another big common one. Because when you think about it, your thyroid hormone affects energy level, but it also affects metabolism. So when your thyroid is lower, your metabolism is slower. And so what that means is you'll see people or hear people say, wow, I diet all the time. I really have a hard time losing weight. And, most people will just say, yeah, well, that's because you're eating or you're snacking and blah, blah, blah. And some are. There are some people who just are liars and they're just eating tremendous amount of foods. But then there is a section of people who are really compulsively sticking with their diet. They are working out, and yet the scale doesn't move. And so what's happened is their metabolism has shifted down. And sometimes even just dieting hard shifts it down even more. So what's happened is pretty much their metabolism has come to a standstill. So they're barely burning any calories. Their body's basically in starvation mode and hanging on to every calorie that it can. So what happens is it's super hard for them to lose weight, but very difficult, so it's very easy for them to gain weight, because since their metabolism's low, if they eat a little bit more, boom, they save every one of those calories. So that's why it's frustrating for those people, and it's a problem.
What other symptoms? Brittle nails. Mm-hmm. And then what symptoms for gluten allergies?
Well, there's really, there's severe gluten allergies, and then there's more gluten sensitivities. So by and large, there's way more gluten sensitivities than full-blown gluten allergies. Full-blown gluten allergies, you're actually having like a really kind of an allergic response to eating gluten. So gluten is a protein that's found in wheat products, processed wheat products, and it's found in a lot of other products that you wouldn't think are wheat. It's definitely in bread and pasta and pizza. Pizza is a big trigger for many people. But it's a thickening agent. It's in soups, and it's all kinds of processed food use gluten to thicken up its base. So gluten sensitivity, one of the most common things is fatigue, skin rashes. People develop dry, patchy spots and itching here and there. Even acne, it can be related to that. weight gain, abdominal discomfort. That's a big one, and that's the one that runs the gamut from just intermittently feeling bad after you eat certain foods to really having full-blown bloating, diarrhea, stomach aches, cramping, and all of that. And that's more of the extreme. But there are people that have it, and they have it over and over again, and they just don't put the two together. They'll just say, oh, I ate too much. Oh, or sometimes when I eat at this place, I get a stomach ache, but when you really, I say, how about if you eat this and this and this, and then they kind of all of a sudden the light bulb goes off in their head and say, wow, it is. And so sometimes either just restricting the amount of gluten you eat will help, or kind of trying to cut it out as much as possible. Because even if you really are trying to cut it out as much as possible, you're still probably getting some, because it's impossible almost to go pure gluten-free. And someone who has to go pure gluten-free, they probably have a really, really high sensitivity.
Yeah,
So-
but if you just try to just not eat gluten, for the most part, you're just still going to be in your sauces and things like that. And that's where, if you're not eating bread, pasta, those types of things, then the stuff in the sauce really isn't, unless you're extremely sensitive, it doesn't bother you. And keeping a food diary, if you do have stomach issues, or you feel like, if you have any symptoms like this, any of the skin rashes or anything like that, keeping a food diary and seeing like the pattern of when I eat this happens, that really helps. Food diaries help with everything.
And if there's ever a question about it, because people go, that seems confusing. Well, there are some people, there's a subset of people who are really plagued with a lot of abdominal symptoms, a lot of abdominal complaints after they eat. Oh, I'm always having stomach aches, or I'm always this, or I always feel bad, or I always, all kinds of things. I mean, some people get runny noses, myself included. I mean, I love milk, but I have a mild dairy allergy. I wouldn't say it's an insensitivity, because I don't get a stomach ache, but I get a runny nose. I might even get a little bit of a sore throat, and it doesn't make me feel that great. So there are people that have all these responses, but they don't really correlate them. I mean, it's hard in Florida because we have so many allergies to everything. People just go, oh, my nose is running again. It's probably this, it's probably that. Yeah, it could be, or it could be something that you just ate, or ate, yesterday. So one of the ways to do it, if someone really has a lot of stomach issues and a lot of food things, is to kind of go on what's kind of an elimination diet. And basically what that means is you go to a very, very basic diet of things that will not bother you, and eat that consistently for about a week. And then slowly, one by one, introduce a new food item and see. And at that point, you'll know if that food item is something that's a trigger or not. If it's not a trigger, then that's certainly welcomed into this new group. You have to be careful not to add in stuff that's very complicated as far as how it's prepared. So you have to add in almost like single food items. You couldn't just be on, basically a brown rice and chicken breast diet and then go ahead and eat beef stew and say, oh, yeah, the beef stew made me sick, I can't eat beef stew. Well, there's about 30 things in that, so it could be any one of those things, or eat chili, or eat something that has a big combination of stuff like lasagna. So you have to kind of eat these things individually for a while until you've narrowed it down. And you'll narrow it down. I mean, and it might not be the process that you want to do, and the end result might not be what you want, but that's what it is. Now, that being said, does that mean you can never eat those foods again? No, of course not. You can eat them, but it's better to know when you eat them that they may make you feel bad ahead of time than not. I mean, if you were going to eat hot wings, there's a lot of people like hot wings and they burn their mouth, but they do it by choice. They know, okay, I'm going to pay for this, and they do it, and they pay for it, but they got that bit of pleasure out of it, or wasabi or any of those things. And that's the kind of thing. As long as you can make that choice, that's fine. But to always have these stomach aches and bloating, particularly, I see some people that are, have to do a lot of entertaining in their business. They have to do a lot of luncheons. They have to do a lot of meals. And for them, if they don't put those two things together, they're constantly feeling sick to their stomach all the time when they're having these luncheons, or they're having a luncheon, all of a sudden, and they, it's really cuts back on their productivity. It makes them feel bad. And it's just, it's just bad all the way around.
Someone asked, and they must be on one of the computers that I've signed into because it says Recharge Clinic. Would that be a diarrhea diary?
A diarrhea diary. It could be, but it's not always a diarrhea, but because it's not always that.
I don't know who wrote that, but that was pretty funny.
Yeah. So not everyone gets that. It could be that, but it's not always that. It's just kind of cramping and things like that.
Yeah.
Or fatigue. Mm-hmm.
Gluten, the evil.
Gluten is an evil. Well, it's really not. It's just what's happened is there's so much gluten really in the food now that we eat compared to what there was. In societies that eat these same products, their products are relatively low gluten. In Europe and in Italy and really Russia and those places, their wheat products are much less gluten because of the way it's grown and harvested, and the type of genetically altered plants is not there like it is here. So their gluten load is less. That's why so many of them eat it. They all eat lots of bread and pasta over there. How come they're not experiencing that? And really, if you eat those pastas that are made in Italy from that kind of wheat, or breads from that, you're not going to experience the same thing. And our wheat, has lots of gluten in it because it's been altered to increase the yields per acre, and it's done that very well. So yes, more people are eating, but because of that, the amount of gluten per amount of wheat has increased a lot. So people who may have just been borderline sensitive to it now become more sensitive just because they're getting a higher load of it.
Okay.
Did I beat that horse to death?
You beat it.
Okay. So one of the things I wanted to talk about, because I get asked a lot about, is growth hormone and what are its benefits and what is it and why should we take it? And so what happens is, what I want to talk about is, what does that actually mean? So it's one of those things that people use that term, but there's a lot of different meanings of what that actually is. So
Because
most
a lot of people think just bodybuilding.
Correct.
But that's not really what you're referring to.
Right. And so, but there's, what they use that term to encompass a lot of different supplements that are out there that are not all actually growth hormone. They get lumped into that category of growth hormone. So, because people can actually take growth hormone per se, which is actually a synthetic or a made form of the growth hormone that your body makes, or they could take another set of medications which are called peptides or precursors or secretagogues. And this whole set of medications, which has been booming really over the past 10 years and is really kind of exciting, are what are called releasing peptides. So I know I've probably talked about some of this before, but so growth hormone starts going down in your body really in 20s, just like all of the other hormones do. And growth hormone is really responsible for bone health, muscle health, skin health, mental clarity. It does help with cardiovascular stuff as well. It helps with wound healing. It helps with all sorts of things like that. And so it helps with sleep. It's a very powerful metabolism booster. So that's one of those things that, as when we're younger, we have lots more growth hormone, and that's why our metabolisms are better. We can eat more and not gain weight. But as it goes down, that's another thing that happens. And so it really does help our skin and our complexion. And that's where where these things, growth hormone or any of these precursors, have really come into play, and people talk about them as being anti-aging. Because one, they do improve your skin. They improve the elasticity in your skin. They make your skin look more youthful, but they also do help your brain function. And so what's happened is these peptides, because that's really what they're referred to, are not only made so that you can take them orally or by injection, but now they're actually made so that they're in a lot of skin products. So you might see skin products that say have peptides and stuff in them. And so in this way, in some of that way, they have them, so they're actually increasing this stuff on your skin as well. So I just wanted to kind of go over some of the more common ones so that people can know what they are. So there's really 3 or 4 main ones. There's growth there, and I'll use the initials too. There's GHRP2, there's GHRP6, and those stand for growth hormone release peptide number 2, as well as growth hormone release peptide number 6. There's Samorelin, and then there's Ipamorelin. Samorelin was one of the first ones that came out. Samorelin is very safe. It's the safest one. Not that any of them are bad, but it was kind of the first one. Then Ipamorelin came out, and Ipamorelin is another precursor. The way these precursors work is they stimulate. You take these things either by mouth or by injection, so that's the way they have to be taken. And what they do is they stimulate your pituitary gland indirectly to actually release the growth hormone. So what happens is, unlike other hormone problems that people have, like with testosterone, their testicles stop producing it, or women, their ovaries stop producing it, or thyroid, your thyroid's not producing it or converting it. Growth hormone, there's plenty of growth hormone. Your pituitary has enough growth hormone for you to last well over 100 years. What happens is the receptors kind of get numbed from stimulation, so they don't release it. So what they came up with before they really had a good understanding of these release peptides is they would just give people growth hormone directly. And so, you know, initially started out that people who had AIDS, who have difficulty gaining weight, or people who had really bad burn injuries, they would get growth hormone in the hospital to help their wounds heal. People who had a growth hormone deficiency when they were young to add to their height. And then people started using it for anti-aging. And then bodybuilders certainly use that in super high doses, unfortunately, to really build a lot of muscle mass. So I will come back because
all right,
I'm
we'll
only
finish
partway
that
through that.
when we come back.
I am GOAT. The GOAT FM.
Hey, this is Cynthia from Recharge Clinic. You need to come by and get one of our amazing vitamin IVs. Dr. Tieche has made a great cocktail that's going to help you have more energy, lose weight, a better libido, and even sleep better. Come see us at Recharge Clinic, 47 Southwest 17th Street in Ocala, Florida. RechargeOcalaClinic.com. That's RechargeOcalaClinic.com.
It's going to happen to all of us. It is the one insurance we can guarantee there will be a claim on. So the question becomes, will your family have enough money to pay for their mortgage, for their food, or their education? Or will they have to borrow money and struggle? Lauren Gibson State Farm has a solution for every situation and can help get you protected today. Take care of your loved ones and take the worry off your mind. Please visit our website, insuredbylauren.com, or call us at 352-355-3340.
Hello guys, this is Dr. Steve Tieche from Recharge Clinic in Ocala. Guys, it's very common to have erectile dysfunction, also known as ED. About 50% of men, even as young as those in their 20s, experience this. Do you experience low energy, low libido, and difficulty losing weight? Don't be embarrassed, just get help and start feeling like $1 million again. Check out my website, rechargeocalaclinic.com, or call my office to get started, 352-512-9996, to start feeling great again.
Isn't it time to get to the beach? Whether it's a vacation, family getaway, or business meeting, the Holiday Isle Oceanfront Resort on St. Augustine Beach is your ideal destination. Relax on our beautiful beaches or poolside and grab a drink at the Tiki Bar and dine in at the Beach Garden Restaurant and Lounge. We're minutes away from historic downtown St. Augustine. Make plans with your family and friends or schedule your next business meeting at the Holiday Isle Oceanfront Resort at 1-800-626-SAND or online at holidayisleoceanfront.com.
This is Trey Adams, the owner of Touchdown Lawn Care. Touchdown! Touchdown Lawn Care offers a wide variety of lawn care services that would transform your lawn into a beautiful landscape. If your yard is in need of some professional attention, or you simply do not have the time to maintain it, then call Touchdown Lawn Care to receive the treatment your lawn deserves. Look us up on Facebook or call 352-598-3720. Touchdown!
This is Justin and Magic Matt. Dang it. Keep going. Join us at 8 a.m. on Monday mornings for Unwanted Opinions, sponsored by the Touchdown Group. Servicing all your pool, lawn, and cleaning needs. Score big this season with the Touchdown Group. I'm not doing a show with a Magic Matt. Why not? Then you're going to be known as Magic Matt. Someone sounds a lot a bit jealous right now.
You have a lot of choices on your radio dial. But there's nothing like talking to the GOAT.
Hello, Cynthia with Dr. Tieche here. We were just talking about peptides and growth hormone and using that for what?
Anti-aging, rejuvenation, feeling good.
Is that why you told me I should use it? Are you trying to make me younger?
I'm trying. So I should take a bath in it. Anyway, so of the other two, so really what they do is where I left off was they stimulate your pituitary to release little packets of growth hormone. And actually, they do it way better than actually taking growth hormone itself, because it's much more physiological. Growth hormone gets released anywhere from 4 to 6 times throughout the day naturally. And so when we take these peptides, precursors, secretagogues, whatever you want to call them, some clinics call them growth hormone, but they are not growth hormone to be specific, but some people like to mislead things. And anyway, so they do release it. They cause it to be released physiologically and increase its amounts, in fact, actually higher than if you were to take external growth hormone, and they are a lot safer. So some of the other ones are, like I had mentioned, growth hormone release peptide 2. That is probably the newest one out there that's gotten the most attention. That one releases the most growth hormone and has the least typical side effects of what some of them have. So what it does is it causes the highest level. It causes the most muscle building. It causes the most skin protection, bone protection, improved sleep, things like that. Then there's GHRP6, and that's another one that really came out before the number 2 one, and it does work well for muscle mass and some of the other stuff. But one of the problems that it has, as all growth hormones do, is they stimulate your appetite, because they work similarly to stimulating ghrelin, which is a peptide that's released out of your stomach. And so what happens is some of these things cause significant amount of hunger. And what you want to do is, when you do take them, you don't really want to eat right away afterwards, even though they're stimulating hunger. That's not it's not a natural type hunger. It is like a voracious hunger. So you pretty much want to take it and go to bed or something like that, because you're sort of defeating the purpose if you're trying to use it. Because one of the main things that these things do is all of them do is they increase fat loss. They increase lipolysis. So bodybuilders use them as what we call a cutting agent, and some people who are just trying to get leaner will increase their growth hormone just like they will increase their testosterone, and it naturally burns more calories and cuts off fat. So it's kind of a neat thing that it does that. But if you're getting this response of increased hunger and you're eating a lot, then you're sort of counteracting that.
Yeah.
So ipamorelin is probably the middle of the road one. That's one that you can take orally. It causes no hunger at all. So that's one of its advantages. Really? Yeah. So its advantage is it doesn't cause as much hunger. That's a tablet you can take, but it doesn't have the same level of growth hormone boosting. GRP2, that's the one that causes the most growth hormone one, but it does have some hunger. 6 is probably, it's good for the level, but it has the most hunger. So that's probably the one that people don't want to take.
So can I ask you some questions about them?
I know you're gonna.
Okay. How are they taken, and what other side effects are there? How safe are these?
So they're incredibly safe. They're incredibly safe compared to taking growth hormone directly. Now, even taking growth hormone itself is fairly safe in moderate doses. So all of these things have a range of medication, of usefulness. So as everything that people do, if a little is good, then a lot is, or 10 times the amount's better. We see that with people who take testosterone. We see that with people who take any kind of anabolic steroids. In small doses, those help build muscle mass, and they're very safe. When you take 10 times the amount, then that's when they start not being. Same thing with growth hormone. It can produce a tremendous amount of muscle mass. But one of the things that it does is it causes a lot of your blood sugar to go super high in high doses. So people can actually become diabetics from that. So people that are taking high doses have to watch their blood sugar very closely. Now, the peptides don't cause those responses because they really only stimulate, they can maximally stimulate those receptors, but they only release that amount. So they don't typically have those responses. They don't have any estrogenic effects like testosterone. There's no aromatization. So there's no increase in estrogen. There's no increase in breast size in men, what's called gynecomastia. There's none of that. There's no increase in oil production. There's no more acne. There's no virilization, which is another problem that testosterone can cause. Mostly for women, if their level gets too high, virilization or masculinization, where they worry about kind of getting some man-like symptoms, there's none of that. So these things are safe for both men and women to take. They do improve your sleep and all of that.
Are they oral?
No, the only one that is oral is ipamorelin. and that's a tablet, and you can take, and it's very rapidly absorbed, and it's all absorbed. It doesn't have much metabolism, so it's not broken down. The other ones are by injection, and so you can take them pretty much 5 times a week. You can take them every other day, but you have to take them several times a week. And there's really just a max dose that you take. It is a very small amount. It ends up just being 200 micrograms, which is the smallest amount, which is a very small amount in a syringe. It's given in an insulin syringe. And most people you can inject it anywhere. You know, if you listen to certain people, they say, oh, you have to inject it in your stomach and you have to inject in fat. That's all hogwash. Old wives' tale stuff. You can inject it anywhere and it's going to work the same level because everything gets absorbed the same.
Where would one get this?
Well, so these things all have to be obtained from a physician. I'm sure you can order some of this stuff on some crazy online websites, but I would choose not to do that.
Yeah, let's not do that.
We obtain all of this stuff. We have it formulated from a compounding pharmacy, so we have a combination of GRP2
and it's something that you write.
You write a prescription for, but
you also
we actually dispense it. So it's actually patient specific. We show you how to take it and its benefits. Now, another thing that of all of these things, and it's really true of all hormone therapy, is that you have to be on it for a little while. So it's very uncommon, although a lot of people feel great immediately after taking testosterone or even thyroid. That's not the norm. The norm is your body has to get readjusted to all of these changes that you're making, rev up its metabolism or whatever it's going to do. So it takes a little bit. So these peptides, really, honestly, the best time is to be on them for at least 4 months. Some people can be on them the rest of their life. There's no downside to taking them long term, correct? And it's the same thing, even if people take growth hormone, they really should take it for 4 to 6 months, then cycle off of it. Testosterone's another one that you can take the rest of your life, but there's other stuff that people have to cycle on and off of. So it's very safe, but the thing that I want to emphasize to people is if you just buy it and take it for a couple of weeks or a month, you say, I didn't notice anything. And you probably won't, because it takes a while for it to work. And there's a lot of things that are that way that you're not going to see dramatic changes. Even people that we give testosterone to, they don't feel instantly better. It's got to get into their system. It has to work. It has to create those changes that are going on in there, kind of reconfigure everything, and then they start feeling better. So, I'd love everything to be an instant pixie dust kind of fix, but it's not.
Yeah, makes sense. So, interesting. And I know that is true. I've seen that with people that it really doesn't work for several months. And then when it works, it's pretty awesome.
So another thing is there's a lot of athletes who might use testosterone to boost their muscle mass or just their athleticism. And not everyone is getting bigger that takes testosterone. We have a lot of bikers, bicyclists that use it to improve performance. And, these guys are not taking high doses. They're just taking enough to get them back to that physiologic range where they were when they were younger. Biking is a great exercise that people do all the way up until their 70s or 80s or whatever. So these guys have lost their testosterone and they can't ride as far as they want. You put them back on it and they're riding again. So these peptides are a great thing to add on top of testosterone, but there are a lot of athletes who are basically taking a break from their workouts and stuff, and it's a great thing for them to take in their off seasons because it helps with that fat loss, it helps maintain muscle mass, and it has very few side effects.
You've convinced me. I'll take it.
Can I give you your shots?
No.
Oh. So what I think we still have a few minutes left.
3 or 4 minutes.
3 or 4 minutes. Well, what I wanted to talk about was something that I had mentioned earlier about when we talked about the person that we found with prostate cancer and doing labs, and why it's so important to just, there's a lot of clinics that are popping up and copying what we do around here, and that's okay. There's a lot of people that need therapy, and that's fine. I just want everyone to be getting the best care. And some of them just do spot testosterone, and that's why I would wash that up. And so my concern is if someone walks in and they do a finger stick testosterone, say, yep, your testosterone's low, you need testosterone, and start treating them, maybe most of the time they'll be right, but some of the times people have other problems and it needs to be evaluated. You need to get everything checked before you do these. These are some big changes you're making to yourself. It's not just, it's not just like buying a smoothie or something. You have to really take some care with some of it, and I don't want to be willy-nilly with it, and that's kind of why I see people who have had stuff done that way, and I rub my head and go, wow. You know, how does that person sleep at night that they do these things? But there are, and so I see this happening with that, and you know, that's one of the things. You know, we've had some recharge clinic haters that are out there bashing us, and is that music starting?
No.
Yeah, and so now I always hear the music in my head. But anyway, I guess it's good to hear music.
That's
in your
another
head.
problem. We'll talk about another time.
Anyway. Well, at least it's not bad. But anyway, so they have posted stuff about us, taking pictures of.
No, wait. Let's tell the story.
Well, I'm gonna. Okay.
Okay. So we, like a week or two ago, Dr. Tieche was kind of dehydrated, so we gave him, Chase, our wonderful medic, gave him a really large bag of fluid and put some vitamins in there. So I take a picture, put it on Instagram, Facebook. I don't know if I put it on Facebook. I put it on Instagram. Hey, Chase is taking care of Dr. Tieche here. So another clinic that maybe possibly is hurting for business, I'm not really sure what, but took our picture off of our page and said, are you just buying an expensive bag of Gatorade for your IV? And then showed our picture, legit our picture, because you could see the corner of Chase's head, and then put a picture of their IV and said, look at, you see how dark it is? That's because we put a lot more vitamins in it. And we were just like, interesting. So why would the bags be different colors?
Well, you know, and so they made some comments. Interestingly, they made some comments like, well, we use high dose vitamins to treat all these medical conditions and chronic medical conditions and stuff like that. And the idiocy of that whole thing is that whoever wrote that didn't even think about what they were saying. But so typically there's really only two things that give the vitamins color. And neither of them are used in high doses to treat any medical problems. So that just shows. So it's B12 and B complex. B12 is yellow. I mean, B12 is red. B complex is yellow. And so added together, that's what adds the vitamin color. Every other vitamin that we use is clear. And all of the vitamins that we use in high doses to treat anything, whether it be high dose vitamin C, high dose glutathione, or any combinations of all that, which are used to treat fibromyalgia, cancer, Crohn's disease, get that. So that solution would be clear. So this little jib jab at us
It was entertaining.
It was entertaining and pointless.
All right, we will see you next week. Hey, this is Cynthia from Recharge Clinic. Guys, are you ready to feel like you're in your prime again? Dr. Tieche is Ocala's leading medical doctor treating you for hormone replacement, weight loss, vitamin infusions, and more. You can feel confident that you are being treated by an experienced, knowledgeable, caring physician. Come see us, 47 Southwest 17th Street, Ocala, or give us a call, 352-512-9996.